My name is Blaine Smith. I'm the Stock Readiness Supervisor at DLA Distribution, Puget Sound. In 2007, while deployed on the USS John C. Stennis, I started having symptoms that were concerning. And upon our return in September of 2007, I was diagnosed with colon cancer. I had surgery in October of 2007. There were some complications. It turned into a pretty serious surgery. I was in the hospital about 50 days, and because of that, it basically ended my naval career. That was pretty devastating to me. I remember the day they walked in the hospital room and told me that my career was over. It was even more devastating because in January of that year, me and my wife had our first and only child after years of trying. So I kind of went into a what now scenario. Definitely a setback. Luckily for me, after being officially retired from the Navy in 2008, summer of 2008, I came on board DLA in October of 2008 as an SDR technician. I had a clean bill of health at that time, and as a matter of fact, the doctors told me that I had a 99% chance of never having to deal with anything like this again. Unfortunately, about 11 months later, I had some pain in the stomach, and I remember in the emergency room, doctors huddled around a computer screen, which is never good, and they informed me that there was activity in the liver. So I went on chemo, January of 2009. Had a conversation with my doctor, my oncologist, and he had asked me if I understood the severity of what was happening, and I did somewhat. And I asked him what my prognosis was, and he mentioned that he didn't like to take away anybody's hope, but that what he did know was that if the drugs did not work, I should have my affairs taken care of within 9 months. Kind of refused to believe that. It just didn't make sense to me that I would have a child after years of trying and all this was happening. It just didn't equate. Didn't believe it. Started doing chemo for a few months, and a doctor called me at home, very excited, and he said, "Look, I'm not a surgeon, I'm not a radiologist, but I looked at your CT scan and I think we're in business." So I underwent another surgery. They removed tumors from my liver, and I went back on chemo for about 3 more months. After that, I had a pretty good remission. Thought things were going good, and then in 2013, October of 2013, a tumor came back again in my liver, and I went back on chemo. The good thing for me is where I work. DLA has allowed me, they've been literally at my bedside a couple times, informing me that, they know I have a lot to worry about, but my job is not one of those things. They've given me flexible work schedule, and really just taken that worry away from me, which has been awesome. The employees around me have all been supportive. I've been able to work my way up through the ranks at DLA. I'm now a supervisor. I know now, even though I'm on a lower dosing of chemo, and it still makes me sick sometimes, I know now that when I'm not here, the crew is going to take care of things. They know to do that, and so really support for coming from every direction. I'm active in the cancer community, and I mentor newly diagnosed cancer patients, and I know that that's not always the case, and I know that there's advocacy groups that are out there that help cancer patients, that their organization is not so supportive, and I think that is unfortunately more the norm. For a similar prognosis, I think the best piece of advice is to not necessarily believe what you read and what you hear. My prognosis, like I said, was 9 months, and that was back in 2009. I didn't believe it, and I have actually outlived my doctor. My doctor at that time has since retired. And he mentioned to me before he retired, he says, "I remember what you said to me, is that this was just not supposed to happen." And there's been scientific studies on the connection between attitude and outcomes and the way people think. So despite what the challenge may be, you need to remain positive A person can be resilient, but that resilience gets multiplied 100 times when you're in an environment that is so supportive. If you know somebody that's going through something, consider that and be as supportive as you can, because I know I couldn't do it by myself.